Okay, so I want to see somebody else that doesn't have brown teeth that speaks English then.
Well, earlier in the week, this video of an Ontario woman demanding a white doctor at a medical clinic went viral around the world. The video prompting medical practitioners to share similar stories, and many actually say the racist rant was not an isolated incident, but rather an ongoing issue in the healthcare field. Well, to talk about this, we're now joined by Dr. Hakique Virani in Edmonton. Dr. Virani, thank you for joining us today. I want to begin with your reaction when you saw that video for the first time.
Well, I think that, the first reaction is, well, it's just horrific to see it on YouTube. But, on second thought, it's not something that happens rarely in healthcare. And I think it's probably been increasing over the last couple of years. I was proud with the way that the healthcare professionals dealt with the incident, not responding in kind, and also heartened by the sentiments that were expressed by people who were in the waiting room. Also quite aghast about the way that this woman was behaving.
Well, sorry to interrupt there, but when people see this video, Canadians of all different backgrounds and colors, many hope that we're beyond this, but we're hearing that this is not an isolated incident.
No, it's not isolated, and I would say that we may have been able to feel we were beyond it a couple of years ago, but this sort of thing is happening more and more frequently now. And I think, it's really important to recognize that we in healthcare are generally, in occupied positions of privilege, and we're sort of insulated from the real ugliness of racism, but our patients oftentimes are not, and they really do experience the horrible side of racism, both in terms of the things that people say to them, but also in the systemic discrimination that affects their health and well-being in general.
Mm-hmm. Well, let's talk about that, because if we're talking about racism in the medical field, as you say, it's not just one-sided when we look at this debate.
No, it's true. I think that there's probably no better example in Canada than the experiences of First Nations and Indigenous people, and how we approach them when they attend emergency rooms, for example, and assume that some of the problems that they present with have to do with lifestyle behaviors or personal health practices, when it might be something quite different. There was a case not too long ago of a fellow who died of a presentation related to appendicitis, which shouldn't kill people. But because it was assumed that his presentation had something to do with alcohol, he was left to dry out and unfortunately died, and that's just unacceptable. I think it's attributable to racism, though.
Mm-hmm, mm-hmm. And as we say, that's one side of the coin. But how about you? You as a person of color, as a man of color who's also a medical professional, have you encountered something similar where someone has said to either you or your assistant, no, I want a white doctor?
It's happened. Certainly when I was a trainee in Calgary, where I grew up, there were cases where it would be some form of mild racism, where somebody will comment about how well I speak English in general, all the way to a patient recoiling when it's time for me to examine them. And I've had patients who've asked that the person next to me, who was a resident who was white, examine them instead. Thankfully, those incidents were rare back then, but I do think that they're increasing.
Why do you think they're increasing?
Well, I'm no expert in politics. My wheelhouse is medicine, but I think some of the dog whistle politics that's been going on in Canada and the United States has sort of emboldened people who ascribe to those views. I think the other problem is...
For example, here in this country?
Well, I think we've had leadership candidates amongst the Conservatives who have sort of called people to question the values and intentions of people entering the country of color. That doesn't strike me as a particularly Canadian thing. My family's been in Canada since the 70s, almost a third of the time that Canada's been a country. And not to mention, some of the people who are the most serious victims of racism have been here for millennia before the rest of us. So I think that, part of it is that we've sort of aspired to tolerance, when I think what we should be doing is trying to understand each other and appreciate each other, not just tolerate that some people who look different are here.
Do you think there'll ever be a time when people are beyond the color of a medical practitioner's skin or a patient's skin color or what they wear in their head or what religious symbol they wear around their neck?
I really hope so. I mean, what's been heartening about the response to this video was, for one, many of my colleagues who were most outraged by it were white, and so that to me is positive and encouraging. But I also think that Canadians in general were quite put off by the idea that people can get away with screaming for a white doctor, and some of the comments that were made were very hurtful. Now, at the same time, we recognize that when people enter healthcare environments, they're vulnerable, particularly if it's a child with them who's sick. They're not at their best, and so we have to understand that. But it does show that these sentiments run deep in some people in Canada, and the best way, I think, to respond to that is to get to know one another better.
Dr. Virani, thank you for this.
My pleasure, Michael.
That's Hakique Virani in Edmonton. Stay with us. You're watching CBC News Network.